Congratulations on donating a kidney and giving the gift of life to a person in need. This presentation is to review your post-donation care plan. We will review some expectations during the recovery period and some requirements once you return home from the hospital. I would like to now introduce you to all the members of your donor team. I'd like you to first meet our transplant surgeons, Dr. Apt, Dr. Abu Ghazala, Dr. Dunn, Dr. Levine, and Dr. Redfield. While one of these surgeons performed your surgery, you may meet other surgeons during your inpatient stay or in the clinic setting. These are our kidney specialists. They are Dr. Leon Burke-Yu, Dr. Kapak, and Dr. Reese. These physicians were involved in your donor evaluation and will continue to be involved in your donor aftercare. My name is Mary Cate Wilhelm, and I'm a physician assistant. I am a part of the donor team and will be involved in your care going forward. These are our living donor nurse coordinators. Donna, Mary, and Ashley are your first line for any and all communication. This is our support team. You have likely spoken to all of these team members at some point during your evaluation. Sherry and Tish are our medical assistants, and Camila is our new patient coordinator who helps to schedule your appointments. Kate and Vanessa are your independent living donor advocates. Communicating with your team. The easiest way to communicate with your donor team is by pennmedicine. If you need assistance setting up the pennmedicine portal or app, please let your nurse know. You can download the pennmed app from the App Store on your device. Please remember that the portal should only be used for non-urgent questions or concerns. We request that you avoid using personal emails to communicate with your team. In the pennmedicine portal, you can also view upcoming appointments and lab results. It is important to ensure that your notifications are turned on so that you are alerted to a new message or result. Any urgent questions or concerns require a phone call. If it is Monday through Friday, please call the clinic at 215-662-6200. If it is a night, weekend, or holiday, please call 215-662-4000 and ask for the kidney transplant coordinator on call. Make sure to notify the on-call coordinator that you are a kidney donor. Any prescriptions that you will need as it relates to donation will be delivered to your room prior to discharge. If you require any medication refills, please contact your donor team. Your medications will include a stool softener, laxative, and pain medications. Constipation after donation can be mild and at times severe. I'd like to review the medications used to prevent and treat constipation. Docusate or Colace is a mild stool softener and should be taken twice a day with a full glass of water. Most donors require this initially. Senna and Miralax are two different types of laxatives. They can be taken in combination with the stool softener. Most donors require at least one laxative after surgery until you have your first bowel movement. Some donors continue to require these medicines even after their first bowel movement, especially if they continue to use narcotic pain medications. If needed, all of these medications can be taken together. With all stool softeners and laxatives, you should stop taking them if you develop loose stools. Hydration and walking will also help to manage constipation. For pain management, you will be given 3 different types of medication: Tylenol, patches, and narcotics. Tylenol or acetaminophen is best for mild pain and should be taken every 6 to 8 hours as needed. We recommend taking Tylenol 3 times a day in the beginning to try to minimize the amount of narcotics you will need. Do not take more than 3,000 milligrams of Tylenol in a 24-hour period. Lidocaine patches are numbing patches that you can cut and place around the incisions. Do not place these over any incisions. Keep the patches on for 12 hours and then remove for 12 hours. Narcotics like oxycodone or hydromorphone are stronger pain medications that you can use for severe breakthrough pain. Take these with food and only as needed. Narcotics are addictive and can impair your physical and mental abilities. For this reason, you should never drive while on narcotics. Side effects from narcotics include constipation, itching, nausea, and dizziness. Most donors are able to stop narcotic medications before their 7th day after surgery. If your pain is not being controlled with these medications, you should contact your donor team. While we do not expect you to be completely pain-free, we want the pain to be tolerable so you are still able to move around and take deep breaths without difficulty. We recommend that all kidney donors avoid the class of medication called NSAIDs. Examples of these are ibuprofen, Motrin, Advil, Aleve, and naproxen. When you return home after hospital discharge, you may notice a diminished appetite. You may feel full more quickly when eating. This will improve over time. You may need to eat smaller, more frequent meals. As your bowel pattern normalizes, you may resume your previous diet. Talk to your donor team before pursuing any strict or high-protein diets. It is very important to stay well hydrated with 1.5 to 2 liters of fluid per day. Even if your appetite is poor, you should ensure you are adequately hydrating. Most donors report fatigue after surgery. You may feel tired, or you may notice you have energy in the mornings and tire easily by the afternoon. Either way, rest when you need to. It takes about 1 month for your energy to return to normal. Do not drive for the first 2 weeks after surgery. You should not drive while taking narcotics. We encourage you to walk at home, including walking outside and climbing stairs. This helps improve healing and promotes return of strength and regular bowel movements. An abdominal binder is an elastic support that is available in the hospital and can help with pain control when you are up and walking. You should take this home with you. There will be some restrictions on exercise over the coming weeks. We ask that you not begin any exercise routine until you speak with your team. You should avoid strenuous exercises and avoid any activity that engages your core muscles. Do not lift, push, or pull more than 10 pounds for the first 6 weeks after surgery. Instructions on how to increase your activity safely to avoid risk of hernia will be reviewed at your clinic visit. You may resume sexual activity when you are comfortable with this, recognizing that this may be uncomfortable for the first few weeks. We recommend that our female donors avoid pregnancy for the first 6 to 12 months to allow your abdominal wall muscles time to heal. Remember that any future pregnancies will require closer monitoring with the maternal fetal medicine team or high-risk obstetrician. If you are a male, please note that you may experience testicular swelling and sensitivity. Please contact your donor team if this becomes painful. Care of incisions. At the time of your surgery, a gauze bandage was placed over your largest incision. This should be removed before you are discharged home. You will most likely have steri strips across the incision, along with dissolvable sutures. Rarely, your incision will be closed with staples. Steri strips are special band-aids that will eventually fall off. You should not remove them yourself, but they may fall off before your follow-up visit, and that's okay. You can leave your incision open to the air, or you may cover it loosely with gauze. You are permitted to shower with soap and water over the incision, but take care to pat your incision completely dry and avoid scrubbing the incision. You are not permitted to take tub baths or swim at this time. You may notice numbness or tingling at your incisions, and this may persist for months. There are some symptoms that are more concerning during your recovery period. You should call the clinic if you have a fever higher than 101 degrees Fahrenheit, chills, nausea, vomiting, or severe or worsening abdominal pain. You should call if you are experiencing shortness of breath, chest pain, pain when taking a deep breath, swelling or pain in your calf, dizziness, or lightheadedness. If you develop redness around your incision or drainage from your incision, please send us a picture through the portal and call the clinic for instructions. You should contact us if you are exposed to COVID-19 or develop any signs or symptoms of COVID-19, which we will review shortly. Follow-up care. You will have an in-person post-op visit 2 to 4 weeks after surgery. At this visit, you will have vital signs taken, blood work completed, and you will meet with your surgeon and one of our physician assistants. Please remember that you must wear a mask or face covering to all clinic visits. At the 6-week mark, you will receive either a phone call or a message in the portal to review your new lifting restrictions and discuss how you should increase your physical activity. You will need to follow up with your primary care doctor for your routine health care. 6 months after donation, you will be scheduled for a telemedicine visit with the donor team. Please speak with your donor team if you need to change the timing of this appointment or if you prefer to be seen in person. In many cases, your 1 year and 2 year follow-up can be completed via telephone. At the 6-month, 1 year, and 2 year visits, we will need to review a questionnaire, obtain a recent blood pressure and weight, as well as blood and urine studies. It is important that this information be obtained close to your anniversary date. All lab work must be ordered by your Penn donor team and will be billed to the Penn Living Donor Program. Labs must be drawn at a Penn or Quest lab. If you receive any bills, you should alert your donor coordinator. Quest labs will be sent to you electronically. Contact your coordinator for Penn lab orders. We are required to report your health data to UNOS, the United Network for Organ Sharing. This includes your creatinine, blood pressure, weight, and urine studies. This must be completed at 6 months, 1 year, and 2 years after donation. It is extremely important to stay in touch with the Penn donor team at these time points so we can assess your overall kidney health. Additionally, this data is also used as our program's report card to show how great our donors are doing after donation. Please notify our center if you are diagnosed with cancer or develop a complication related to kidney donation. Long-term follow-up. Lifelong annual follow-up with your primary care provider is extremely important. This includes blood pressure monitoring and screenings for diabetes as well as cancer. Your annual kidney labs should always include a basic metabolic panel, which includes creatinine, a urinalysis with microscopic, and a urine protein creatinine ratio. The urine tests are to monitor for any blood or protein in the urine. We in the Penn Donor Program will review your labs for the first 2 years following donation. Thereafter, your labs will be ordered and reviewed by your primary care doctor. After the 2 year mark, lab orders will be billed to your personal insurance. Close follow-up after donation is extremely important for your continued good health. We are now going to review COVID-19 symptoms and recommendations. As you know, donors are not at an increased risk to contract COVID-19. The risk of complications from COVID-19 for kidney donors remains unclear. There is insufficient information right now about the rates of complications following donation as compared to the general population. Symptoms of COVID-19 may include fever, cough, shortness of breath, stomach upset, diarrhea, loss of taste or smell. If you are ill with any of these symptoms, you should contact your primary care doctor for recommendation. If it is within the first 6 months following donation, you should contact your donor coordinator as well, as we may order additional testing to ensure a healthy recovery after surgery. Our team can also arrange PCR testing if needed. Donors are not required to shelter in place after donation. However, if you live with the recipient, their team may ask you to shelter in place. You should continue to follow all CDC precautions. We strongly encourage everyone, including members of your household and support persons, to wear a surgical mask when indoors for large gatherings. We do not recommend masks for children under 2 or those who have trouble breathing. You should identify a backup support person in case of illness. Avoid those that are sick and don't take any risk of exposure. We strongly recommend that donors pursue COVID-19 vaccination. COVID-19 can be life-threatening, and severe illness can be associated with kidney damage. We recommend you stay up to date on all COVID-19 boosters to not only protect your overall health, but also the health of your kidney. Sheltering in place. If you live with the recipient and are required to shelter in place, you should do the following. Stay home except for essential medical care. Wash your hands often. Clean and disinfect frequently touched surfaces. Take precautions to keep 6 feet of space between you and others. Avoid people who are sick. Stock up on supplies to limit trips outside the house. Make sure household contacts and support persons also take precautions. And you should avoid all cruise travel and non-essential air travel. Additional resources are available at the CDC website below. Whether you have donated a kidney to a friend, family member, or complete stranger, you have given them the gift of life. We want to thank you for choosing Penn Transplant Institute and allowing us to take part in your kidney donation.